Health Minister Dr. Zweli Mkhize says his department needs more money. He tabled his 62.5 billion rand budget yesterday, saying several health services have been affected by the prioritising of COVID-19. Mkhize's budget was met with mixed reaction from opposition parties. Let's unpack it further with Professor Alex van den Heever, a specialist in health economics and finance. He's in Johannesburg this morning. Prof, a very good morning to you. Thanks for your time. So let's look at that budget of just over 60 billion, 9 billion rand dedicated to COVID-19 treatment. One would imagine, of course, that's absolutely not enough if you have to look at what's happening at the moment, if you look at figures this morning and infections rising.
Well, that's the amount that has been allocated through the health budget. And there's an amount of probably around about 10 billion rand that is being held in reserve by National Treasury according to the main budget. And that would only be allocated if there is a need for it. So this 9 billion rand is probably a fair reflection of what the sort of COVID expenses are going to be in this financial year. And one can expect that there are going to be expenses in the next financial year. So I think there is a kind of a 3-year view on the overall strategy. And 9 billion rand to me doesn't seem inappropriate, given the costings of the vaccine programs that I've done and other people have done.
Well, I suppose the question is how we actually use that 9 billion rand.
So this should be principally for the vaccine rollout. And unfortunately, government didn't really arrange a framework to recover monies from people who, for instance, on medical schemes, and maybe that will arise during the process of the year. But as it stands, government will basically foot the entire bill for the vaccine program. But I think to me, it looks as though it will be okay, and the funds shouldn't be deployed inappropriately. And I expect that National Treasury will be looking very, very closely at how the funds are spent. And that's why I think, in addition, they've kept the money in reserve within National Treasury.
And while we keep our eye on COVID-19 at the moment, Prof, I mean, the Minister's saying that there are several other health services that have been affected because we focus so much on COVID-19. So where do you think we need to start paying more attention and putting in more money? Where have we sort of dropped the ball as we focus on COVID-19?
I think health services across the board have been under stress in particular ways. But we've also seen a patient demand drop off, both in the public and the private sectors. And we can expect that there is going to be a recovery in demand in the next 18 months. But I think health services, it's difficult to pinpoint specific areas because it's a massive system. And it's essentially a bottom-up system. You budget from below based on your sort of needs. So typically at national level, they don't necessarily have a perfect view of what the specific needs are of the system. So I think we're going to see some pressures. There have always been pressures on the health system, but I don't think that pouring money into the system is going to make a huge difference in the short term. But I think in the medium term, we do have to look at personnel within the health system and how we boost in an orderly and coherent way the sort of staffing of our key priority health services and make sure that they are properly governed. And I think that would be a key priority going forward, because a lot of money is wasted in this system.
Well, Prof, let's just look at now this looming third wave. And if the numbers this morning are anything to go by, we've recorded over 3,000 new coronavirus cases. That third wave looks like very much a reality, and it doesn't seem like it's very far away. What do you think needs to happen? A lot of people talking about, do we go back, take lockdown, sort of take it up a couple of levels. Do you think that that's where we might be headed?
It could be if we carry on going, carry on seeing these increases, in particular in Gauteng, which is a very high-risk area, very concentrated populations, and still a very large population that is susceptible to infection. So it's quite probable that it's conceivable that certain restrictions are considered that target gatherings, indoor gatherings, in the next few weeks. But there's a question as to whether or not you look for a short, sharp, brief set of restrictions now before it gets extreme, or you wait until the wave really takes off and then you introduce restrictions. There's a tendency to wait until it becomes quite extreme first. and the health services are under pressure. But if you, for instance, had 5 days of restrictions versus what might be a month at the end of, as a wave really seriously takes off. But I think we're still at the early stages, but it does definitely look as though we've got an upward trend, a significant upward trend. And really the question now is the nature of the intervention.
And it really couldn't have come at a worse time, could it? I mean, we've got our senior citizens expected to get into those queues from next Monday. And from what we've seen, that process hasn't been smooth enough. It has posed a bit of a danger if you look at what has happened with healthcare workers, the snaking queues that we've seen, the miscommunication as well. So one has to wonder, we're putting them out there. And if this third wave continues to get even closer, we could be looking at putting them in quite a bit of danger.
So this was the concern right at the beginning with the vaccine program, in that it would have been better to have rolled out a sort of a national program from February rather than from May, because we're going into the colder period now, and where we do have a sort of a systematic risk of a third wave, such as the provinces that haven't been hit as bad in the past. This is the time that's most danger is expected. So yes, people are at risk, and we'll have to be extremely careful. And even if people get vaccinated during this period, it's only going to be after a while that they develop the required immunity to prevent severe illness. So people are going to really have to be very careful now during this period, and we're probably going to see a very high risk period until after July, because that's really when it peaked last year in the coldest winter months.
Well, with all of this being considered, then, Prof, and if we have to look at the health minister's budget and particularly problematic provinces, then where would you say, how would that allocation have to work? Would we look at certain provinces just being prioritized over others in terms of money?
Not for the vaccine program. Essentially, the vaccine program should be rolled out evenly across all provinces at the same time. I don't think there will be any change in sort of relative prioritization there. If we do see that there is a particular province that experiences a crisis from a service delivery perspective, for instance, they're running out of beds or oxygen, I think at that point you do want to, and something that I thought should have really been done last year, that at a national level, additional resources are made available for oxygen, for coordination, and for opening beds and so on, and not just from the provincial allocations. And that process is more focused on where the risks, where the risks are highest. But I think that in terms of the vaccine program, it should be even across all the provinces based on their population.
All right, thanks very much for that. We'll leave it there for now, Professor Alex van den Heever, just looking at just what we can expect coming up with this looming third wave, and then the health minister's budget, and how much can we do with that if things actually do get worse, as they seem to be doing.